Hey guys, my name's Dan, I'm a veterinarian, and today, does your doggy need back surgery? Back surgery is actually really common, guys. There's a handful of dog breeds like French Bulldogs, Dachshunds, chondrodystrophic doggies that are unfortunately more predisposed to having back problems because the disc material mineralizes much earlier in life and makes them far more predisposed to throwing their back out, we'll say, or having an intervertebral disc disease issue, compressing the spinal cord and causing major back issues. Today, I'm gonna go over the 4 things, guys, the 4 levels of damage you will see from a back injury in a doggy. Of course, always go see your veterinarian, always. Your veterinarian can diagnose it, tell you what they think, and then your veterinarian will recommend surgery or medical management. Back surgery is commonly done. A lot of veterinary specialists do it these days. General practitioner myself, not so much, but will refer out to have a hemilaminectomy done to relieve pressure on the back. When a doggy throws their back out or has intervertebral disc disease, there are different levels of damage. Now, the more damage we have, the more we're gonna notice and be able to be like, man, we need surgery. The most serious is when we lose deep pain. Deep pain is really important, guys. If your veterinarian said we don't have deep pain, that means back surgery is needed. And even with back surgery, some of these dogs will never walk again, unfortunately. The next level of damage, less severe, is going to be loss of superficial pain. Superficial pain is really easy to assess. There's far less pressure being applied, and the doggy can respond to things much quicker. Now remember, guys, I'm looking for a response, not a reflex. A response is when I press on the doggy's foot and the doggy looks at me, barks at me, tries to bite me. I hate that idea, but I need to see the respond. I do not care if the dog pulls their leg back or if their tail's moving. These are reflexes in a reflex arch, and that doesn't give me any information about the spinal cord functionality. Now, we have deep pain, superficial pain. Both of these, if we lose these 2 levels of pain, surgery is definitely recommended and should be sought after to give us the best chance to walk again. Now guys, number 3, moving in less severity, is gonna be the ability to walk. This is where things get a little bit blurry. Now, if a doggy can't walk, yeah, surgery is needed. If a doggy can walk, but they can't stand very well, or they drag their legs on occasion, or they fall over off and on, a lot more veterinary specialists are starting to recommend surgery for these cases because we know now our imaging's better by taking MRIs, and our surgeons are amazing now. So they can get in there with that hemilaminectomy, relieve that pressure, and get a lot of these doggies doing better, quicker, and have a higher success rate than medicine in these cases. Last but not least is proprioception. This is where the doggy can walk, but proprioception is the ability to feel myself in space. So I touch my nose. I can reach over here and I can touch this L, you know? Like I can feel everything in space. Now a doggy that loses the ability to have proprioception, or they have proprioception deficit, when I place their feet on the ground, they don't correct them, right guys? So I place it and like, I don't feel it, I don't know where it is, and they can still walk beautifully, but they may be ataxic, they may stumble a little bit, but they can walk. So doggies that lose the ability to have proprioception, this is the one case where a lot of veterinarians will not do surgery because there is a really good chance that medical management with various meds from steroids to NSAIDs to pain meds to muscle relaxers, there's a whole bunch of options out there, and your veterinarian will give you meds as they deem fit for the situation, for the medical needs of your doggy. But this is one of those cases where consulting with a specialist is always a good idea, but loss of just proprioception tells me that we have a very superficial damage to the spine. In a lot of these cases, we're not jumping to surgery right away. We are monitoring, 100%. We're keeping a really close eye on these kids because we want to make sure, guys, that they're not getting worse. I've had some doggies, my goodness, especially French Bulldogs. I feel like they start off with proprioception deficits, and I start them on some meds, and I say watch them, and very quickly they get worse. That's the last thing I want to mention, guys. time is everything. You need to be on top of it. If things change, you need to be calling your veterinarian, seeing a specialist, having surgery done if things are getting worse in a hurry. As things progress along, we need to make sure that we're addressing them so they're not getting worse on us. If things get worse, the game plan has to change. If you guys would please go ahead and comment, leave some good information below, have your experiences on there. I'd greatly appreciate it. I hope you guys have a great week. I hope you and your doggies are happy and healthy, and you guys take care. As always, man, that was a good one, I think. I think that was a good one. Very little editing on that one.